Hi everyone, my name is Dr Rumina Taylor and I'm the Chief Clinical Officer at HelloSelf. HelloSelf is made up of a network of clinical and counselling psychologists and CBT therapists. Our clinicians have a broad range of expertise and specialisms, which means we can match you with the best therapist to accompany you on your journey to becoming your better self. There are many different types of therapy available, but which works best for you will depend on your goals and your experiences. At HelloSelf, we work using an evidence-based approach, which means our therapists also draw on science and research when working with members to guide treatment. Cognitive behavioural therapy, or CBT, is an evidence-based psychological intervention, which has been shown to be effective for a number of different mental health difficulties. It seeks to understand the relationship between thoughts, feelings, behaviours and physical sensations. CBT is a collaborative approach where the therapist and client work together to develop techniques and exercises to ease distress, such as different ways of managing unhelpful thoughts or changing behaviours that in the short term might make us feel better, but in the longer term only serve to prolong our difficulties and distress. EMDR stands for eye movement, desensitisation and reprocessing. This is an evidence-based psychological intervention to support those who have experienced trauma and/or are experiencing symptoms of PTSD. EMDR is a structured therapy, and the therapist work with the client to focus on the trauma memory while engaging in bilateral simulation, normally eye movements. Cognitive analytical therapy, or CAT, involves assessing how a person thinks, feels and acts in the context of past events and relationships that may affect this. Once again, this is a tailored therapy. The client, their experience and goals are at the centre. Acceptance and commitment therapy, or ACT, aims to develop psychological flexibility. It combines mindfulness skills with a practice of acceptance. ACT supports clients to be present-focused and to be open to difficult experiences rather than pushing these away or avoiding such experiences. There is also a focus on identifying someone's values for living and engaging in value-based behaviours. Compassion-focused therapy supports people to relate to their difficulties in compassionate ways and was originally developed to work with shame and self-criticism. Like ACT, CFT includes mindfulness technique in addition to specific imagery work to develop self-compassion. That is the ability to soothe ourselves and provide ourselves with encouragement to move forward. At HelloSelf, our clinicians will work with you towards a treatment approach that is best for your needs, whether it's a single type of therapy such as CBT or an integrative approach that brings multiple techniques into your sessions. Thanks very much for watching. Follow our social channels for more information and advice.